Victor, thank you very much, and I'd especially like to thank all of you who are here today to hear about the latest steps in the VitalDirections process at the National Academy, all of you who have helped us work together on this, and especially my fellow panelists and the contributors to these reports. As you all know, we are living at in a very important time for healthcare reform. Many of you all, I know, are engaged in the current debate that is ongoing about the future of the Affordable Care Act and what might replace it. That critical as those issues are, we want to emphasize in this report that we are focusing here on some fundamental trends that were here before the ACA debate that's going on now and that are going to remain after. And however that debate turns out, the kinds of issues that we are focusing on in VitalDirections need to be addressed. We need to find ways, whatever happens in this legislation on coverage, to provide coverage at a lower cost. We need to find ways to address some fundamental trends that are challenging our ability to achieve this vision of a health system that performs optimally in promoting, protecting, and restoring the health of all individuals and populations and helps each person reach their full potential for health and well-being. Victor gave you an overview of how the reports have come together. What we're releasing today is a summary, a kind of cross-cutting document that describes some of the key themes that we found on reflection and on further discussion with many of you and others to be key points that cut across these different reports. We're boiling it down to 4 action priorities alongside 4 essential infrastructure needs, and I'm going to briefly talk about those and how we think there is a path forward for addressing them, but a path forward that does need to be addressed now. This chart, which many of you have seen in the paper, highlights that there are 3 things that the federal government spends money on: Social Security, which is rising with the retirement of the baby boom, the healthcare programs, that's the red, and everything else. And the big story, long-term, Democratic, Republican administrations in the past and going forward, again, whatever happens in the debate over the next couple of weeks, is that the healthcare programs are becoming more and more important as a component of total federal spending. And that has some important implications for the way that we're approaching health in this country. One implication, also made very clear in the report, is that we now are squeezing down a lot of the resources that have been going to other areas. So this is a chart courtesy of Betsy Bradley's research at Yale that places the United States in the context of total health and social services spending across all developed countries. And you notice that the U.S. is not an outlier in terms of the total spending on all of these programs. Where the U.S. is an outlier is the relative share that goes to healthcare spending versus other social services and support programs. And the reason that those other programs is so important, as we highlight in our set of reports, is that there are lots of factors other than traditional healthcare that are the primary determinants of the health of individuals and populations. Those social factors, those environmental factors, those community factors are an important and central part of all of our reports and a central part of the cross-cutting themes that we're going to discuss today. And in this context, it becomes even more urgent to find ways to get more value for what we're spending in healthcare. This chart reprises some of the previous work that the National Academy has done and others have done, highlighting the substantial opportunities for doing a better job with the resources that we are putting into healthcare, with everything from unnecessary services to misprevention opportunities, excess administrative costs, all contributing to health care that costs more than it needs to and is doing less for the health of our population and is providing not the optimal environment for supporting innovation that really leads to better outcomes at lower costs. So that led to the 4 cross-cutting themes for action that we wanted to highlight today in the paper that's being released. One of those is paying for value. In many of the papers released as part of the report, there's a recurrent theme of our payments in healthcare not really being aligned with what we want to see happen. For example, in mental health services, fragmented payment systems between medical and behavioral and social services that all really need to work together to get better outcomes for individuals. How do we overcome that? The report describes ways in which the payments can be shifted to focus on value, that is, the outcomes, the results that matter to patient health and well-being compared to the costs involved in delivering those results. So it's about alignment of payments with the outcomes and results that we want to see, enabling a broader range of activities to be undertaken that do deliver the best outcomes for patients at the lowest cost. We know there are some challenges in getting there. We have some vital directions related to the competencies that healthcare organizations need to develop. It is not the same thing to be able to deliver specific services well as it is to focus in on what really matters for a patient and how to deliver that set of services at the lowest overall cost. It requires a new set of competencies, but we think there are some promising directions for making that happen, which we discuss in the report. Also central to all of this, as you probably gathered from my emphasis on improving the health of individuals and well-being of individuals and populations, is empowering people. A cross-cutting theme in many of these vital directions is the opportunity to make health more democratic. This can be done through steps like supporting the linkage between health services and personal context. Again, what matters to each individual often differs. Finding ways to make care more convenient and accessible through tools like telehealth, and very importantly, guaranteeing patients access and ownership for their personal information. I should say too, in these cross-cutting themes, we're seeing a lot of evidence of bipartisan interest. The payment reform issues, for example, supported by last year's so-called macro legislation, and some of these ideas for more patient control of their data, for example, being supported by recent bipartisan legislation like the 21st Century Cures Act. Also, a critical cross-cutting theme is the importance of activating and supporting communities. So much of health is determined by where we live, what we're exposed to, who we are around. And the reports describe a number of vital directions that can make it easier to support stronger, healthier communities. Many of these activities need to take place at the state and local level, as we describe in the report. Many of these activities require breaking down silos for different types of community support activities and programs, and providing more technical assistance and guidance for local efforts and best practices for how community health can be improved. There is no way to change those big trends that I showed you before without putting a central emphasis on bringing community health more front and center in our policies related to health and health care. Finally, a fourth big action theme that we found across many of our specific reports is the notion of connecting care. As you've heard from me already, we're focusing on individuals and populations and what matters to people. It's very hard to support efforts at the person level if it's not possible to get relevant and actionable information in time to enable action at the person level. So this involves going that last mile in creating end-to-end interoperability, and we describe some directions for supporting steps like that. It involves taking steps to support a learning healthcare system. I'm going to come back to that issue in a minute. But all of these actions, I hope you can see, are reinforcing of each other. The more that we pay, the more that we pay for what matters, the more that we empower individuals to guide what matters, the more that the financial support will be there to enable these kinds of connections of data and information to make effective person-level decisions. We also highlighted 4 key infrastructure capacity needs to help drive these kinds of actions. One of these is measuring what matters. There has been a tremendous amount of proliferation of measurement in healthcare, as every clinician knows in the United States today. Those measures, while maybe individually sensible, are not yet adding up to a consistent and clear, comprehensive impact on helping us focus on what matters most to improving population health. So in our reports, several of our vital directions relate to supporting the development and use of core measures, building on prior National Academy reports that can provide a clearer beacon or set of beacons for where healthcare reform should head. That's not to say that specific measures in specific areas aren't needed below these big cross-cutting core measures. It just means that we need to keep a focus on how we're measuring and supporting what matters most to patients in the delivery of care and in reforming our healthcare system. We also had a number of recommendations related to modernizing skills and training our 21st century health and healthcare workforce to keep up with these tremendous new opportunities. This means a shift in areas like medical education, for example, to a greater emphasis on team-based training and continuous improvement capacities rather than on silos of care and individual technical expertise alone. It also means new steps in the science workforce to support larger scale projects that can take advantage of the emerging data and the big science opportunities. Another very important cross-cutting theme is a learning healthcare system, accelerating the development of real-world evidence. Again, this relates to the actions that I've talked about before. If we have better support, better incentives, better person-level engagement in sharing data to make a difference in patient care, that same data can be the basis of evidence that can help improve care in the future. We describe a number of directions in the different reports that can foster more data sharing while protecting patient privacy and actually enhancing patient control, but making it possible to learn a lot more quickly about medical technologies. So instead of very costly traditional clinical trials, randomized trials done in not very real-world settings, capacities to learn more, including through randomized and other studies in this learning healthcare system built off electronic data capabilities, and more opportunities to share this data to help with patient decision-making and care improvement. Finally, I want to emphasize an infrastructure theme of advancing science. Besides this effort for real-world evidence, besides the retraining and the new training directions that I've just described, a number of our recommendations related to ways to make the research process itself more productive and impactful. This includes further adaptations in regulatory frameworks for developing medical products and learning how to use them effectively. You can see how those recommendations would fit with the themes that I've already described. And again, these are areas where there's some bipartisan interest. And also public-private partnerships for supporting these activities. Finally, underlying all of this is the tremendous importance and the tremendous opportunities related to basic and applied sciences today and the importance of research funding to support all of those efforts. But again, not research funding the way we've done it traditionally, research funding that reflects these vital new directions for achieving a better health and healthcare system. So as Victor emphasized, this is an important occasion for us today for putting together these key themes and helping to share our learning so far from the Vital Directions efforts. There will be further effort by the National Academy, and hopefully all of us working together, since I think there is a lot that all political sides can build on here, to think about the implications for legislation, for administrative actions, for state actions, for public-private collaborations, for actions at the community level to help implement and further develop some of these ideas. And we all look forward to working together with you on these critical, vital issues for the future. Thank you all very much again for your interest and support for this effort. Thank you. And I'd now like to turn to our panelists for some opening comments. Then we're going to open this up to a broader discussion in the room. I'll start with Governor Leavitt for these comments.